The MD Diagnostics RP Check is a battery-operated portable device to measure mouth and nasal pressures. Small and lightweight, the RP Check allows pediatric and adult patients to be tested in any setting. The RP Check can provide 3 key measurements: maximal inspiratory pressure, maximal expiratory pressure, and sniff nasal inspiratory pressure. All measurements are in cmH2O. Secondary measurements are derived from the MIP and MEP test, and these are maximum rate of pressure development, maximum relaxation rate. The device will also measure peak pressure. For MIP and MEP measurements, a proprietary patented inspiratory and expiratory valve and filter system is utilised. These are colour-coded for ease of use. The MIP valve filter is pink and the MEP filter is blue. For SNIP measurements, soft, flexible nasal olives are available in 3 sizes to suit various nostrils. These are connected to the device via the nasal probe adapter. A USB cable, battery and instruction manual are also included. To operate as a standalone device, firstly install the battery, ensuring the terminals are correctly aligned. The battery should allow up to 20 hours of use. Turn the device on and the screen will display the MD Diagnostics logo and software version number. The screen will either show the test selection screen or the upload test screen. If the upload test screen is shown, then 3 options are available. Select and confirm yes to upload the current test records. This will be covered when the PC software is used. Select and confirm no to delete the stored records and change to the test selection screen. Select continue testing to add further tests to an existing set. The display will change back to the test screen and pressing the enter key will change back to the test icon, allowing further tests to be performed. Please note, the continue testing option allows the previous test to continue. A different test type cannot be selected. For example, if the patient was performing MIP tests, needs a rest, and the device times out and turns off, the results and graphs are saved. Additional MIP testing can then be performed for this patient. If the test selection screen is displayed, then select the required test. To select a test, press the function key holding it down on the highlighted test type. To scroll to a different test type, press the function key to scroll to a different test. Insert the pink MIP valve filter into the device, ensuring a good fit, with the valve facing downwards. The valve filter will only fit one way. On selecting MIP, the display will show the MIP test graphic with the Please Inhale Now text along with a slow bleep. Insert the mouthpiece into the subject's mouth, ensuring that the lips are tight around the mouthpiece, the flange is positioned over the gums, and inside the lips and the tongue are not obstructing the mouthpiece. Instruct the subject to exhale slowly as far as possible to residual volume and then inhale as hard and fast as possible for at least 1.5 seconds. When inhalation starts, a longer audible bleep will be heard. If no inhalation occurs, then a shorter audible bleep is heard, indicating the device is waiting for the test to be performed. Once the test is complete, a short audible bleep is heard to signify that the test has been completed satisfactorily. The display will show the maximum average inspiratory pressure sustained over a 1-second period and the variation at 100%. A cup icon indicates the best test result. Pressing the function key momentarily allows the operator to see the pressure time curve and the derived parameters. Press and hold down the function key to continue testing. It is recommended a minimum of 3 tests are performed. Use the best result to denote the maximum achievable. The ATS recommends for reproducibility that the minimum of 3 tests should be within 20% of the highest pressure obtained. If a test does not meet the minimum period of 1.5 seconds, the display will show the stopwatch icon and pressing the function key will display the test icon so the test can be repeated. The MEP test is performed in a similar way to the MIP test, except that the blue MEP filter is used and the test starts with a full inspiration followed by a maximal forced expiration. The MEP test is selected and the subject inspires fully to total lung capacity and forcibly expires as hard as they can. The pressure measured is displayed, and on pressing the function key, the pressure time curve and the derived parameters are displayed. Insert the nasal probe adapter into the device. Select the appropriate nasal probe and twist into place on the adapter. Switch the device on and select the SNIP test and the SNIP icon will appear. Insert the nasal probe into the nostril so that it fits snugly. Some lubricating gel can sometimes help with obtaining a good seal. Ask the subject to take a maximal sniff as hard and as fast as they can. The display shows the maximum pressure generated, along with the pressure time curve. The non-occluded nostril can be occluded by the subject if required. This will depend on local guidelines. The test can be repeated by selecting and holding down the function key. Follow the link provided from MD Diagnostics. Download the RP software from the Microsoft Store and open the application. If the device has tests stored, then these can be uploaded by selecting Yes on the first screen. Connect the USB cable provided to the device and plug into the PC. To start data transfer, select Connect on the PC. The refresh button may need to be pressed to select the correct USB port. A previous patient may be selected using the search function or new patient details entered using the Add Patient button. Enter patient details as required, select this patient and upload the data by selecting the Upload icon. The tests on the device can be downloaded and stored or deleted. Additional tests of the same type may be added by selecting the Start Test icon. If downloaded, the tests are shown with the associated graph and predicted values. By selecting Show Tests, all tests performed by number can be selected. The best test can then be selected for archiving, either as a PDF or CSV file. The PDF saved test can then be printed from the stored folder. To perform a test live, select or enter patient data, then select the test type and predicted value set. To commence, press Start Test and follow the instructions on the device. For subsequent tests, press Start Test on the PC until you have a satisfactory test. To change the general settings, click on the icon on the upper left. This will allow you to change the organisation and doctor setting. For more information on the RP Check device, please email sales@mdd.org.uk or visit our website www.mdd.org.uk.